I am Dr. Sivakumar, Professor of Psychiatry and Head Geriatric Psychiatry Unit, Department of Psychiatry in the National Institute of Mental Health and Neurosciences, Bengaluru. I am also a technical advisor for Dementia India Alliance and Honorary Secretary of Indian Association of Geriatric Mental Health. Dementia due to Alzheimer's disease is emerging as an important public health problem globally, and particularly in developing countries like India, where the population aging is happening rapidly. It is an important problem which needs to be managed. September 21st is recognized as the World Alzheimer's Day, and the entire month of September is also observed as a World Alzheimer's Month. There is a big challenge in terms of lack of awareness among the public as well as health professionals about the Alzheimer's disease and the impact of dementia. So hence, during this month, there's a lot of awareness activities are conducted globally to promote early diagnosis, early intervention, and to provide appropriate support services for ensuring the well-being of persons with dementia. Today, we have a lot of evidence related to how much this is a problem globally as well as in India. World over, one person is developing dementia every 3 seconds, which is an alarming kind of a number. In India, the estimate from the Longitudinal Aging Study of India Diagnostic Assessment of Dementia Study, which is a nationwide study done with a rigorous methodology, it indicates that almost 88 lakh of persons with dementia are there as per the population of 2016. It is projected to increase to 1.69 crores by 2036. We have a lot of challenge in terms of delay in seeking help. Almost 80% of the public feels that dementia is part of normal aging. In the latest survey which is done globally, it indicates that even 65% of health professionals consider dementia as part of normal aging. And also there is an issue about stigma, and people also feel that since dementia is something which is not curable, many times people don't seek help and there is a nihilistic attitude. So what we today also have a very good data and evidence is that almost 45 to 50% of dementia prevalence can be reduced by addressing 10 to 12 modifiable risk factors. So some of the important risk factors like, say, childhood education, as well as conditions like hearing impairment, depression, social isolation, diabetes, hypertension, obesity, reduced physical activity, dyslipidemia, and smoking, alcohol, even air pollution. All these risk factors are modifiable across the lifespan, life course, and if concerted action is taken, there is a good scope for prevention and delaying the diagnosis of dementia. There are other important advances that has happened is now we can diagnose Alzheimer's disease early using biomarkers, and there are clinical tests available as well as investigations available which can confirm the diagnosis of Alzheimer's disease. There is a hope that we may have newer treatments which are already approved globally, but these drugs which are giving a lot of promise, they may be available soon even in developing countries. Nevertheless, this is something like where only drugs will not be a solution. We need to have a holistic approach where prevention has to be an important focus, and also providing care for those who have already developed dementia, which includes training the caregivers and providing appropriate support services like daycare services, residential care services, and even providing appropriate support in the community is very, very important. So in this context, there are a lot of NGOs which are also contributing a lot, like Dementia India Alliance and institutions like NIMANS and various other academic and institutions and people interested in dementia are promoting awareness during this day. And there are services like caregiver support groups are available in Bangalore. An online support group is also available. And for managing a person with dementia, there is a lot of information is required. And once the understanding of the family member is there, many of the behavioral problems can be handled without using high dose of medications. simple behavioral strategies actually can help in improving the quality of life. And this particular challenge is a public health priority, and it needs a concerted effort from the professionals as well as the government and the civil society and various stakeholders who are involved in providing care and support for persons with dementia. Let us all unite and make dementia a condition which can be managed very well, and also there is a hope for persons with dementia who can live well even with a complex condition like dementia. The quality of life can be ensured. The longevity of elderly people is something, a very, very important achievement because of the improvement in public health and various health services what has happened. The life expectancy of any person who was born in India was in 40s during our independence. Over the past 75 years, it has almost reached more than 70 years. Now, this longevity is something which is contributing to population aging, and older adults number is increasing rapidly. It is going to double in the next 2 decades. And when it comes to older adults, the health issues are something which is very important. And in that, the mental health issues are going to contribute to significant amount of challenge, and also it is an important contributor for ensuring the well-being of the individual. Almost 1/5 of older adults have some or other mental health problems. The most common mental health problem is depression and anxiety. People may have subsyndromal depressive symptoms. They may not have symptoms which is severe enough for them to seek professional help. But however, studies have shown that 1/3 of elderly population have significant depressive symptoms, which indeed contributes to their distress as well as affects their well-being. And there are risk factors which contributes to this, significant depressive symptoms. One of the important things is about the changes in the support systems. Their loneliness and social isolation is something which is emerging as an important public health problem. And the support services for various chronic health conditions, again, is an important factor. And a lot of family changes that is happening, dynamics, the changes in the support system is again something which is inevitable with the development. Hence, there is a need to promote age-friendly health systems and age-friendly environment, which will provide appropriate support for them to improve their well-being, and non-medical interventions, which should happen at a community level, should take care of the subsyndromal depressive symptoms. And WHO has recommended task sharing approach, where we can train people who are volunteers and who are the family caregivers, and even self-help that can help in addressing some of these symptoms. But almost 5 to 6% of them may have serious mental health conditions, which include severe depressions or somebody having more severe anxiety, which is contributing to significant dysfunction. They need professional help. Both psychological interventions and medications can help. There is lots of myths and misbeliefs about mental health. Stigma is another important barrier why people don't seek help. Usually people think that they'll become dependent on medications. There is a scope for providing safe and appropriate treatment for mental health conditions with a proper health professional. And non-medical interventions are really something which has good evidence for the initial or milder level kind of problems of mental health, including depression and anxiety. And untreated depression, anxiety again contributes to increased risk for serious mental health conditions like dementia. And it is also one of the important contributors for increased risk for morbidity and mortality, including suicide. So hence, any mental health problem in elderly needs to be paid attention, and seeking help and seeking evaluation from a professional would be the most appropriate kind of initial step. And it requires a continued and sustained intervention, whether it is pharmacological or non-pharmacological. And we should do a lot of awareness to promote change in attitude among the older adults as well as their family members and caregivers and society to ensure an age-friendly environment, and also counter the ageism, which is a factor which determines the help seeking from the individual as well as how support is provided to the individual. So ageism is another important agenda for the decade of healthy aging of the United Nations, which from 2021 to 30, combating ageism is very important. And age-friendly environment is again another important action item. And whatever care is given for mental health and physical health, we need to provide as a integrated care. Integrated and holistic care is something very important. And also providing long-term care support systems is again an important thing. Considerable number of people would require support systems for them to live in the community and promote independence. For the long-term care, support systems are required, including institution support. The geriatric clinic and services in the National Institute of Mental Health and Neurosciences has already been existing for the past 25 years and has contributed to the care of elderly with mental health problems. One of the important initiatives the geriatric services in NIMHANS has taken is an outreach initiative called Vayo Manasa Sanjeevani. This is an initiative which is to support the United Nations Decade of Healthy Aging from 2021 to 30. And this initiative is the aim of the initiative is to promote healthy aging, and it involves promoting awareness among the senior citizens and other stakeholders. So in this initiative, for the last 4 years, every Monday we have a public awareness webinar which is done in English and alternatingly in Kannada. There are also other programs that is happening in Tamil. So this program is an initiative which involves active participation of senior citizens as volunteers and various topics related to mental health, physical health, social issues, and issues that are concerning senior citizens are being discussed by experts as well as interactions with the senior citizens. And these recorded videos are also available in the Vayo Manasa Sanjeevani YouTube channel. And we welcome senior citizens to actively participate in this initiative. There is also a public awareness book titled Insights for Healthy Aging. It's freely downloadable from the Vayo Manasa Sanjeevani website, vmsnimhans.in. So this has 2 volumes, 40 chapters, which covers various topics related to healthy aging, that covers physical health, mental health, and social issues related to elderly. We invite active participation from senior citizens as well as the family members and other stakeholders who can contribute to this initiative by providing support and active participation. Thank you.